الله أكبر الله أكبر.
Good evening. I am Dr. Akl. I treat cancer in Flint with radiation. Today's topic would be lung cancer. Last time we started talking about lung cancer and we didn't finish the topic, and this time we'll summarize briefly what we mentioned last time and cover the whole topic of lung cancer. We mentioned that lung cancer is a very common disease, is caused and associated with smoking, either primary smoker or second-hand smoker. Unfortunately, there is no good screening test to diagnose lung cancer early and treat it early. Even though CAT scan, some study about CAT scan, but still premature to know whether that is a good screening test. In the past, thousands of patients were tested using yearly chest X-ray versus similar number of patients, no X-rays, and they found no survival difference between the two groups. Of those who are screened with yearly chest X-ray and those who did not have screen with chest X-ray. The cancer mortality were the same. Because of that, they concluded that screening for lung cancer with chest X-ray is not a good screening test. We also talked about lung cancer is two types, small cell and non-small cell. Small cell lung cancer represent 20% of lung cancer, non-small cell 80% of lung cancer. We primarily talked on non-small cell, and we mentioned about 2/3 of non-small cell lung cancer present with advanced stage, unfortunately. Those with early stage, when they are treated, I'm talking about non-small cell lung cancer with surgery, which is the primary treatment of lung cancer, their prognosis is good. When the tumor is small, no lymph node involvement, the chance of cure is reasonable, 60 to 70%. When the hilar lymph node is involved, the chance about 40%. When the mediastinal nodes we mentioned the nodes around the trachea and major main stem bronchi. And if those nodes are involved, we're talking about 5 to 20%. We mentioned also that if patients could not go for surgery for whatever reason because of medical conditions, then radiation is the second line of therapy. For early cancer, still curable, but is not as good as surgery. For those advanced cases where surgeon could not physically remove the tumor because the tumor is large and invading major blood vessels or major structures, those patients will be treated with chemotherapy and radiation. Some of those patients might benefit from surgery later on, but those are selected patients. And that's brief treatment of non-small cell lung cancer. Small cell lung cancer, on the other hand, is aggressive, represent 20% of all lung cancer, and 20% of it, we talked about 20% of all lung cancer are small cell. And small cell is classified into two groups, limited and advanced. Limited disease 20% also, advanced 80%. So don't be confused here. Small cell 20% of whole lung cancer. Of those 20%, 20% limited or early and 80% advanced. Unfortunately, again, 80% of small cell lung cancer advanced disease. The primary treatment of lung cancer, small cell lung cancer, is chemotherapy. Why is that? Because the disease seems to spread all over the body, and the good news, it responds to chemotherapy quite well. Small cell lung cancer is very aggressive disease. And if for those patients who present with advanced disease, if they are not treated, their median survival few weeks, unfortunately. If they are treated with chemotherapy, their median survival will improve from few weeks to few months. When I say median survival, I mean, if I say median survival 1 year, what does that mean? Mean at 1 year, 50% of patients are alive. That's what it means. So if I say median survival of advanced stage small cell lung cancer, few weeks. That means after few weeks, say 5 or 6 weeks or so, half of the patients are alive. If we don't treat advanced stage small cell lung cancer, the only half of them live few weeks. If we treat them with chemotherapy, and instead of few weeks, it would be few months. Still bad, unfortunately. So after few months, patients still alive, half of them. But there would be long-term survival. At 5 years, maybe 5% are surviving, or 2%. So not everyone have advanced disease, they're gonna die, no, because we seen cases live even longer. So everyone is individual case. I'm just giving you the statistics based on some studies. But again, everyone is different. You need to look all variables. What about for those with limited disease or early stage small cell lung cancer? Early stage small cell lung cancer, the chance they live 2 years is 20%. So when I teach lung cancer to the students or residents, I tell them they need to remember the rule of 20%. That's small cell lung cancer. It is 20% of the whole lung cancer. 20% of them are limited. Those limited means early. Those 20% are limited. When they are treated, they are 20% long-term survival. That's the rule of 20% for small cell lung cancer, which is essentially a very bad disease. Those are treated primarily with chemotherapy, and radiation is given to the chest, and that will enhance the effectiveness of chemotherapy and improve results little bit. Those with limited stage small cell lung cancer, after they complete chemotherapy, again I mentioned chemotherapy is highly effective. Many of those patients get complete